Hey, welcome back to the show. Today, we're talking about testosterone in women. If you missed my episodes on estrogen and progesterone, make sure you go listen to those as well. But if you've been confused about testosterone, hopefully this episode will clear things up for you. First things first, testosterone is not just about getting your mojo back in the bedroom, although that is a pretty nice bonus. It really is so much more than that, especially for us perimenopausal women. Testosterone plays a huge role in your energy levels, your mood, your muscle strength, and even how well you recover after exercise. It is just as important as estrogen and progesterone in helping us really feel our best. So, as we age, our testosterone levels start to dip. And that's when we start to feel like we've hit a wall. It's not just that mid afternoon slump where you feel like you need a nap. It's more of that like exhaustion, especially when you can't get out of bed in the morning and it feels like such a monumental task. So, testosterone helps maintain energy by supporting the production of red blood cells, which carry oxygen to your muscles and your tissues. And with lower levels of testosterone, you may feel sluggish and it can affect your mental sharpness. So, if your brain feels foggy, low testosterone may be one of the issues. When your levels are optimized, it can help with the mental energy as well as physical energy. So, testosterone is also crucial for maintaining muscle mass and strength. As we age, we naturally lose muscle, and that's why strength training is so important. It really does help to preserve muscle mass, which in turn is going to give you a bunch of health benefits, but it will support your metabolism. It will reduce your risk of falls as well as fractures later on in life. And you may not even be thinking about that right now because if you're like most of my listeners, you're probably in your 40s, maybe you're in your early 50s, and that seems like such a ways off. But as you know, it's really important to take action now so that we can minimize our risks later on. I don't know about you, but I really want to be strong, mobile, and as self reliant as possible when I get older. All right, next is brain health. You may not realize this, but testosterone also is involved in cognitive function. So, as your testosterone levels drop, you may notice memory issues, a harder time concentrating, or brain fog. You may feel confused, overwhelmed, forgetful. You may have a lack of focus, lack of mental clarity. This is something that a lot of our clients tell us. They come to us, they're like, I had this brain fog. I don't remember anything. I feel like I can't focus or finish any tasks. It's super frustrating. Testosterone supports brain plasticity. That is your brain's ability to adapt, learn, and function properly. So, keeping your testosterone level in check really does help to keep your mind sharp. And that is really key, not only for work, but also for your life, because it is super embarrassing when you forget somebody's name, you forget what you're about to say. And obviously, nobody wants to be in that position. So, the other thing that's really cool is testosterone also impacts your confidence. Testosterone gives you that inner oomph, that fire. When your testosterone levels are optimized for you, because we're all different, you will feel more assertive. You will feel more motivated and like you're capable of handling anything that life throws your way. Whether that is asking for a raise or it's creating loving boundaries with a family member or a friend or speaking up about something that you've been kind of holding in for a while. Testosterone really does play a big role in that and helps you feel more confident and powerful. So, just to recap, testosterone helps you with your energy, helps with your muscle mass, it helps with your brain health, as well as your confidence. It is not just about feeling sexy or energetic, it is about helping you live your life really fully and with strength and power. That is why it is so important to understand how testosterone works for us as women and why we may need it more than we think, especially in this stage of life. So now you may be thinking, cool. I'll get my blood tested and we'll see if I need some testosterone. Well, yes and no. Like progesterone and estrogen, like I say often, testing testosterone can be tricky. Hormone levels fluctuate a lot, and blood test, or really any test, there's no perfect test, they don't give us the whole story. But we typically have our clients test their total testosterone as well as their free testosterone via blood just to get a baseline idea. Typically, we have them do that in the morning. So, what's most important is your symptoms. If you're noticing low energy, weak muscles, inability to maintain muscle mass, your libido is dipping, or you just don't feel like yourself, those signs really do matter much more than a lab. And unfortunately, it's not uncommon to see somebody who has quote unquote normal testosterone levels who are struggling with these symptoms. So, really get to know your body, listen to the symptoms that you have, because that's going to be a better communicator than any lab test. All right, so on that note, I want to briefly just touch upon PCOS because many women don't realize that that plays a role in perimenopause. PCOS is polycystic ovary syndrome or ovarian syndrome, and often involves those higher androgen levels like DHEA as well as testosterone. So, in this stage of life, PCOS can show up as irregular periods, weight gain, hair loss, or hair thinning, or even like stubborn chin hairs that keep popping up. Super annoying. I have one that pops up on my neck and one on like my cheek. It's like really annoying. I just have to pluck it. You just got to get rid of them. But anyway, testosterone is part of this, and some women with PCOS may have even other high androgen symptoms like oily skin, acne, or even hair growth, or like more hair growth. A lot of women say that they have to shave more often. They notice that the hair on their legs or their arms is darker in this stage of life. And if you start hormone replacement therapy, specifically testosterone replacement, you may experience some of these symptoms. I shared this before that when I initially started testosterone a couple of years ago, I started to break out. I had oilier skin, oilier hair. But what I noticed was that I started off a little too high dose. I should have eased in a little bit more. And now that I've optimized it, it's much more manageable. I'm not dealing with those symptoms. With testosterone, you do typically want to go low and slow, and then obviously increase as needed until you start to really feel good. And for many women, jumping straight into testosterone replacement may not be the best course of action. I didn't start there. If you're still cycling, or even if you don't cycle anymore, starting with progesterone can often help balance some things out before adding in testosterone. So think of it like building a house. Progesterone, in my opinion, is the foundation, and it helps to calm your nervous system, improves your sleep, reduces anxiety. And once you've got that going or optimized, then testosterone can certainly come in and do its thing. Or you may find that you need to add estrogen before testosterone. All that said, I'm not a prescribing provider, of course. I only know what I've seen personally and obviously clinically with clients. And the other thing is, when it comes to estrogen, I think that there's still a lot of fear around it. And that's why a lot of providers will only give women progesterone and or testosterone and kind of leave estrogen for last, or tell you that you don't need to take it until you're like late perimenopause. And I do not agree with that. Again, go listen to the episode on estrogen, as well as previous episodes where I've talked about the benefits of estrogen. When it comes to testosterone replacement for women, this isn't as straightforward as it is for men because there aren't any FDA approved testosterone formulations at the time of this recording for women in the US. That means that most of us have to get compounded formulations or use a low dose of a testosterone product that's made for men via like a standard pharmacy. You will often see testosterone in the form of creams, gels, injections, or pellets. I personally would be cautious with injections or pellets, more so pellets, because once they're in, you can't adjust the dosing and you'll have to wait several months for the hormone levels to decline. So if it's too high of a dose for you and you end up with those androgenic symptoms, you're going to kind of be miserable for a few months. You're just not going to be a happy camper. And then they're kind of a big commitment because you have to go get them inserted every few months or however often. And they can be quite costly for a lot of women. It's just some food for thought. Listen, some people love pellets. They do really well with them. Again, we're all unique, and what works for you may not work for somebody else. So just take this information and do what you will with it. All right, so for most women, creams or gels typically do work well because you can adjust the dose as needed. I am currently using a compounded testosterone cream that I apply every morning, and that seems to work well for me. So, on that note, please know that it can take time to feel the full effects of testosterone once you start. Some women notice it pretty quickly, while other women, it takes months of consistent use to start to notice an improvement in their energy, their libido, their confidence, and so on. All right, all that said, you may not even be considering hormone replacement therapy. Maybe you're somebody who, for whatever reason, doesn't want to use it or can't use it. So you may be thinking, all right, what are some strategies that I could put into practice to support hormone production? So these are the things that I talk about often. I'm just going to do a quick overview of them. Focus on nutrition, right? Testosterone production relies on nutrients like zinc as well as healthy fats. So you want to include lean meats, eggs, nuts, seeds, avocados, fatty fish in your diet. Those things really should be staples. The other thing to consider is low levels of vitamin D. Low levels of vitamin D are linked to lower testosterone. So you do want to try to get 20 minutes of sunlight every day if possible, or even consider supplementing with some K2. That is a cofactor that you need with vitamin D, if you need it. And that means you want to be testing. So we recommend that our clients get tested once, if not twice a year. We do a comprehensive panel with them in the perimenopause method to really see what they actually need, because I don't believe in taking something that you don't need. So looking at your levels is important. The other thing you want to consider is learning how to cope with stress more effectively. Everybody's stressed out nowadays. Everybody. Chronic stress is going to increase cortisol, and that is going to directly suppress testosterone production. So you want to really start to implement stress reducing techniques like meditation, yoga, deep breathing, journaling, and really changing your perception of stress, how you talk about it, your mindset around it. And of course, creating boundaries, saying no more often, all the stuff that I get on my soapbox about here. The other thing to consider are some adaptogenic herbs like ashwagandha or rhodiola. Those can kind of help mitigate some of the stress, physical and emotional. Of course, you want to prioritize sleep. So testosterone production occurs while you sleep. So poor sleep can lower levels. So you want to be aiming for 7 to 9 hours of quality sleep every night, and try to avoid screens before bed. Create some sort of relaxing nighttime routine to really prioritize that. The other thing is strength training. So regular strength training or high intensity interval training like HIIT can support testosterone levels. You want to be focusing on exercises that use large muscle groups like squats, deadlifts, or push-ups. That's going to help stimulate hormone production. And then lastly, there are some herbs that you may want to consider like tribulus, maca, or even fenugreek, but use these with caution, okay? Herbs are not completely benign, and some of them do have contraindications. So on that note, if you want a deeper dive into testosterone, some of the strategies I just mentioned, the non-hormonal options, as well as hormonal options, consider purchasing my limited time course, Ignite Your Libido. It is available now. And if you feel like you've lost your spark, your vitality, like your libido has gone MIA, the good news is that you can reignite it. You can feel confident. You can reconnect with your partner if you have one, if you feel like connection has kind of been lost, to be able to dig deeper and address some nutritional imbalances that may be contributing. You'll have access to an HTMA hair tissue mineral analysis. That's going to assess your micronutrients. That is a test that we use with our clients in the perimenopause method. So if you were not able to join us in the perimenopause method last month for January enrollment, this is a really great option for you. It is a lower cost investment. It is a shorter program, but you're going to get some really great information in the course, and you're going to get access to this leading edge HTMA hair tissue mineral analysis test. So check out the link in my show notes for more information on that, and make sure you get in on that as soon as possible. So there you have it, ladies, the lowdown on testosterone. It is not just for your libido, although that is a pretty nice perk, and it's not a one-size-fits-all solution. So if you're curious about any of the things I talked about here, really start listening to your symptoms, work with a knowledgeable provider, and give yourself some grace during this process. Remember that you are not alone in this perimenopausal journey, whether it's oily skin, chin hairs, or just trying to get through the day without collapsing or having to take a nap. I've got you. We are here to support you, whether you just continue listening to the podcast or you work with us in some capacity. We can help you really start to feel your best. So until next time, take care of yourself. And if you love this episode, please do share it with a friend. And I will see you next time. Hey, before you go, if you're ready to get educated, empowered, and feel your best in your peri years and beyond, grab my must-have guide for women 40 plus navigating hormone changes via the link in the show notes. You'll learn my top 5 strategic diet and lifestyle changes to make ASAP to support your declining hormones and get back your energy, improve your mood, and confidence. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.